COVID cases continue to surge, but experts say that may not be the most important thing to keep an eye on.
Yes, Seth Kaplan joins us with more why people are making the case for paying less attention to cases. Hey, Seth.
Yeah, Mark and Valerie, I want to be clear. No one is saying don't worry about COVID. What more experts are saying is the wrong number of COVID cases may not be as big a deal as it was earlier in the pandemic.
Right now, I'm not really worried.
Not really worried about a deadly virus? Actually, Airlise Croft might be onto something.
I strongly agree with that.
UPMC infectious disease specialist Dr. John Goldman. What he strongly agreed with is the same question we asked Airlise, who we met while she was shopping with Alexander there. Is it time to stop focusing on the number of cases? Dr. Goldman's answer? Yes.
I think the best metric of how bad it is the number of hospitalizations and the number of deaths.
And by those metrics, good news, or at least good news for the vaccinated.
We are actually seeing fewer, not more, vaccinated patients in the hospital with COVID.
Which means Airlise could be right not to worry too much.
I am vaccinated. I got vaccinated because of my son.
Hospitals are rather full, but they're full of different people than before.
In the spring of 2020, the average patient in the hospital was an elderly nursing home patient who was medically very ill.
Now?
Our average patient is young and thought they were healthy before they were admitted.
Another way to look at it, ever since vaccines came out, even though most people in the hospital were unvaccinated, about 10 to 20% were.
That number has actually gone down to around 6 or 7%. It's consistently lower than 10% since Omicron came through.
I feel like we need to just stop focusing on the cases and just start focusing on our health.
And so, yeah, she kind of figured it out. Omicron is very contagious, even for the vaccinated. But Mark and Valerie, if you're vaccinated and not especially elderly or immunocompromised at this point, it's increasingly clear that you shouldn't have to worry too much about this variant.